Hello, I'm Dr. Geoffrey, the crisis and split second decisions expert. Coming to you today to give you an COVID update. But I've got to start off in our typical fashion. The world has changed. The world has already changed a great deal since we last talked. But today's talk, something different. Today's talk, we're going to find out about the one symptom. It's not one, but an important symptom that you need to recognize in anyone who's older. The question is how do you go about defining older? I am a split-second decisions and crisis expert. What I do is, besides being an ER doctor, I live into many organizations and visit many organizations. I teach executives how to make how to manage crisis and make acute, sudden, split-second decisions, as well as change management. But today, we're going to talk about our families. We're going to talk about this symptom that you need to recognize and be able to make a split-second decision about. And this is no hoopla. You must be able to make a split-second decision about this. But first, let's define a split-second decision. There are decisions that we make, listen to this, when there's a time constraint, T, L, lack of information, or C, critical consequences. We call that the TLC framework. And I don't mean 10 to 11 care. Because sudden split-second decisions or sudden decisions, you've got to be ready to act and move. Let's get on to why we're listening. I'm going to set it up this way. I'll tell you what motivated this and what motivated me to do the research and find out, wow, there is something to this. Got a call from a friend in Florida this past weekend. There's a friend that called. He said, hey, I was talking to my dad earlier, and then I called him back, and he said, my dad was suddenly confused. Yeah, I was like, and he said, what did I do, Josh? Because it's like with my boys. I said, well, he was earlier when he was normal when you talked to him a few hours ago. I said, yeah, he was suddenly confused. Well, first, sudden confusion in anyone, but especially the elderly, you dial 911. You got to make that decision right away. It's no calling me. It's no calling a friend. Call 911 or take them to the ER or immediately go over there. Sudden confusion in the elderly is a medical emergency. So the split-second decision is to call 911 or to immediately take them to the hospital. And why is that so important? I mean, I'm gonna get to that, but for one of the causes of this, time is a great issue. But what his father was experiencing was delirium. Delirium. That's delirium. That's the symptom we're going to watch out for as it relates to elderly people. I need you to follow me on this one. Delirium is an acute confusion. It's a loss of you often don't know where you are. You don't know the place where you are. You may not know who you are. And it comes on suddenly and rapid, which is different from dementia. Dementia, it comes on slowly, and it's irreversible. It's irreversible. So we're not talking about dementia. We're talking about acute delirium. Put it more basically, acute confusion, sudden confusion, as in you're talking. You spoke to your mom and dad or your grandpa and like granddaddy at 10 p.m. and then you talk to them an hour later and they're confused. Again, it's a disorientation of time, place, and or person, or they may have illusions. Now, you see this in elderly people. You see this in elderly people. Why? Because as you get older, you get frail, and they do not have the mental reserve. So therefore, things like infection, believe it or not, acute stresses, low blood sugars, and TIAs will cause this. Now let me come full circle. What the news data says is COVID, a sudden COVID infection will cause acute delirium. Yes, a COVID infection will cause acute delirium. Why is that important? A few different reasons. But first, let me give you the data. 20% of those with acute delirium and elderly tested positive. 20% of those. So 20% of COVID positive, this is a different fact. 20% of COVID positive elderly patients, delirium was their only clinical feature. 20% of COVID positive elderly patients, delirium was the only clinical feature, meaning there was no fever, cough. It was sudden confusion. And 1/3 of elderly people who are COVID positive, they lacked of cough and fever. They lacked cough and fever. And the most common symptoms, believe it or not, in the elderly are delirium, tiredness, and breathlessness, feeling that they cannot catch their breath. Now, the unfortunate part is that for the elderly, when they experience acute delirium as it relates to like COVID, their illness is more serious. But the reason why we need to catch it early is because if there's acute delirium as relates to like COVID, we need to make sure that we isolate them as soon as possible and that we get them to the hospital right away so that they can get hydration and whatever else the doctors deem necessary. And I purposely cut it off that way. But the other part to understand about acute delirium, the most common causes are, believe it or not, so home. Let me make you feel better. Acute delirium happens suddenly, quickly. In medicine, in general, this is not always, things that happen suddenly are often curable as well. What you will find in the elderly people, because their mental reserve, due to a number of pathophysiological reasons that we will not go into, their reserve is not as great. So a simple urinary tract infection can cause acute delirium. A low blood sugar can cause acute delirium. That one's a critical one. A low blood sugar. Why? Because that can be treated right away. And if left untreated, it can make things a lot worse, which is why you want to be transported to the emergency department, call 911 if you're not there right away, because a low blood sugar can be treated immediately and fixed and keep from causing worse outcomes. A urinary tract infection is going to take a few hours for the antibiotics to kick in. The other causes are acute intoxication, which we can handle that. Medications. Someone placed on a new medication or sudden medication interaction. Now, let me just share this. You will see this in the ER, because don't forget, I am still practicing. I've been practicing 25 years. I've seen this just many times. Elderly patients have been on the same medications for the same year. No one changed anything. Then all of a sudden it causes an acute interaction, which causes acute delirium. Change the medication and it goes away. Now, the one that's a little bit less reversible, depends on which spectrum you're on, the TIA or the stroke. TIA strokes. If it's a stroke and it causes acute delirium, that's another reason you need to get them to the hospital right away, because they may need to get thrombolytic therapy. Let me reel this in. The take-home point is that in the elderly patients, acute delirium is the only presenting symptom as it relates to a COVID infection. That's 1 in 5. That's 1/5 of the elderly people who get COVID. Delirium, sudden confusion, that is the only presenting symptom. And then 1/3 of elderly COVID positive people, that they lack a cough and fever. Again, people, there are some split-second decisions that we're going to have to be willing to make as it relates to COVID, but especially today as it relates to older people and those who we know who are older. I'm defining older by 65 and older, but if you're 60 and you've got a lot of medical conditions, you may be in that spectrum as well. I would just encourage you. You've got to be prepared to make a split-second decision no matter what is going on. And you've got to also train your mind in being prepared to make split-second decisions. In summary, this is not going to be a big one. I mean, today's talk is not big to a lot of people, meaning that if you don't have older parents or older grandparents, if you don't have someone who's older in your life, this is not much of a red flag for you. But if you do, even with them being healthy now, you must know that, hey, if I call them and they're suddenly confused, or if I go by them, or if for some reason they don't answer the phone, This should be in the back of your mind. This comes out of the journal of British Journal of Medicine. It's not on the CDC site. It's not on the CDC site. Everybody, we are in a crisis. Crisis demands that we have to think about the world differently, interact with the world differently. I would encourage you all to please make sure you choose who to follow. Dr. Fauci, the CDC, WHO, Johns Hopkins COVID website. Excellent, up-to-date source of information. Everybody, we all have to do our part. I would encourage you to share this with someone. I would encourage you to make sure that you are on guard for your older loved ones, because we're entering into a difficult period. We all have to be on the lookout for one another. This is Dr. Geoffrey, and to find out more about me, you can visit me at YouTube at Dr. Geoffrey, Geoffrey. Go to splitsecondDecisions.com. Again, splitsecondDecisions.com. And if you want to reach out to me, you can reach out to me. If those of you who know me already know how to reach out to me. Those of you who don't, you can go to info@splitsecondDecisions.com or instant message me. We will take a few questions right now. But again, everybody, this is about us making sure that we get through this thing together. Let's take a few questions. All right. Hey, what's going on, Selena? Hey, I haven't seen you. L.A. Dixon, what's going on? Sheila Edwards, LaShawn, nice. I saw you recently. Doc, my scope came back normal. 2 years cancer free. All right, can I see everybody? Give me a few thumbs and stars up. Great, your scope came back negative. 2 years cancer free. Congratulations. That's good news. Believe it or not, during COVID, I read this recent study. I haven't developed it, but I'll develop it here. Good news, especially during this period of time with the social unrest, election, and COVID. Good news tends to make people feel better and tends to keep them more upbeat. I know where I was going with that, but I'm not prepared to make that leap. I need to finish the research that I was doing. Let's go back to Nubia phrase. Okay, great information to you, Dr. G's priceless information. Always humble. MIT can overflow your life with the length of days. Continue to bless your hands of healing. Saturate you and your family with 100K years of love and endless people pouring into your lives. I share your broadcast with the elders who are not computer Facebook. I appreciate that, Nubia. Yes, please share it with them, and then share this with them too, because what I've noticed, and it's not just the elderly, it's everybody. Don't let anybody fool you. I'm an ER doctor. I'm on the front line, so I'll be honest with you. Even I feel it just every so often. If you're not feeling differently during this period of time, maybe a little anxiety, maybe a little increased stress, or just a little more amped, then there's probably you don't understand what is going on. But my point is, it's okay for us to feel a little concerned, a little anxious, and stressed at times. But we can't stay there. We can't stay there. We've got to move on past that. And moving on past that means that when good information comes, then good information comes, and we've got to enjoy it. For the elderly, for instance, they are the slowest population they've had the slowest increase of COVID positive people, meaning that the elderly people are less likely to become COVID positive, to get infected with that COVID, than any other group of people. And that's great news. That is great news. Stephanie Benjamin, where have you been? I haven't seen you in a while. Stephanie, what's going on with you? Denise Hamilton, thank you so much. Hey, Denise, what's going on? How are the kids, Denise? Nubia Frazier, my typo, may God. Hey, I got Nubia. Hey, I was just reading. Your typo was good. No, I actually love how you put in capitals too. It made me feel it. Great news. You're right. Was stressed and ready to take the voluntary mental break prior. Hey, and everybody, real quick. One way to deal with stress. I still run in the morning. I still do that. But I'm going to do a show with a psychiatrist from Hopkins on Friday. But some things feel like we can do about stress is it's okay to cry. It's okay for you to say, hey, 6:30, whatever time it is, every day, 6:30 to 6:40, 6:30, 6:45. It's my time to feel sorry for myself. If I need to cry, if I need to call somebody, if I need to feel bad, that's fine. Give yourself between 6:30 and 6:45, or whatever that time is, not in the morning, but later in the day. Give yourself that time and get it out. Get back on that horse and keep moving, because we're likely in for a difficult period. We're likely in for a difficult period. Having said that, I have so everything that, follow me this one. Everything I say, not everything, most things I say comes from the CDC, WHO, listserv of doctors I'm on, are evidence-based articles. But I will be doing a live soon about, if you are going to get together for Thanksgiving, this is how you can do it as safely as possible. Notice I didn't say I recommend it. That's not what I said. I said, if you're going to do this anyways, this is how we're going to do it safely. Look for that live to come on to come on next Monday. Look for that live till I come next Monday. And it's going to require some true leadership in your family. More about that soon. Let's get up a few more, then we will get out of here. I read that COVID test was only about 75% accurate. From what you're aware, is there? Yes. Depends on which test you use, but the COVID swab, it's about 70 to 75% accurate. And there are some tests that are on the market that are even less accurate than that. So you say, well, what do you do with that information? It just depends. My pause is I'm trying to figure out how I'm going to address this from the ER point of view or from a father point of view, and I will do both. From an ER point of view, because I still practice and I see COVID patients. When you come in and you have COVID symptoms, and you say, "Hey, but I just had a test and like it was negative." Test doesn't mean anything to me. All right, and I'm not saying the test is a data point. You have COVID symptoms, therefore I'm going to treat you like you have COVID. Bottom line. Recently, and I can, since it's my son, I can share it, because I'm the HIPAA for him. So recently we had the same thing happen in our household. My son, he had a cough, he had a fever, and so we isolated him, but this happens to him about this time of year. We went and got the test. Didn't tell anybody. Probably wouldn't tell you about it didn't tell anybody, but his was negative. And because I was a parent who's interacting with him a lot, I took one too. Mine was negative as well. So because he clinically improved, and his test was negative, and my test was like negative, we took him off of isolation after about 10 days. But if you have symptoms, give me 2 minutes. If you have symptoms and you have a negative test, I would still treat myself like you're COVID positive. All right. Hopefully that helps. It was a little wordy, but hopefully that helps. Hey, these symptoms are getting all confusing to all. Can you talk about the muscle aches and pains? Many of us have pains and cramps regularly. Would you make COVID-related muscle pains distinguishable? What would you? It's hard to, because the latest literature just says muscle pain. So I would say muscle aches. Put it in a context. If you have muscle aches because you just finished working out, then it's not related to to COVID. But if you have muscle aches and a cough, muscle aches, cough, and a fever, you most likely have COVID. But what I promise you, because that is a great question, Selena, and my next live, we're going to review the symptoms, and there are 2 new symptoms. 2 new symptoms. You want me to tell you? You gotta wait till the next live. There are 2 new symptoms that we needed to talk about, anyways. But I will review the newest symptoms. Great question. And then Denise, all right, everybody, thank you. Be safe. Share this with somebody. Look out for one another. Oh, if you get COVID or if you think you have COVID, there's a COVID toolkit attached to this. A bit.ly. Please be sure to get that bit.ly and use it. You don't want to wait until you have COVID. And then the reason why and let me be very clear. Part of the reason is I'm trying to collect email addresses. I'm going to be very clear. Trying to collect email addresses. Why? For those of you all who have been rocking with me, you are also aware that I was hacked and I didn't have people's email addresses that I had. We just kept it going over Zoom. If Facebook ever closes me down again, I'm using the email addresses. We're going to keep it going just over Zoom. But for more information on making split-second decisions, there's a bit.ly there. For more information on being prepared for if you get COVID, there's a bit.ly there. But whatever you do, be safe. Oh, real quick, be ready to vote. If you got to go vote in person, cool. Look out my previous lives. You can go to YouTube at Dr. Geoffrey, part 4. It tells you what you need to vote. Real quick, you need masks. You need 2 masks. You need hand sanitizers. Get yourself a personal fan, gloves, and make sure you socially distance. Because if you've got to go and vote live, you can vote safely. You can vote safely. COVID is not a one-to-one transmission. Hey, everybody, I've got to go. We got somebody who is waiting for me. Be safe and do something kind for someone out there. And be sure to share this with your older loved ones. Talk to you soon.